So it's been 3 weeks since big cuts to how much the state reimburses child care providers for families with lower incomes went into effect. The Family Social Services Administration cut provider reimbursement rates as a way to close a $225 million funding gap. So with providers getting less money from the state, they've had to make up the loss somehow. We spoke with child care providers who said it's really become a catch-22 with lower reimbursement rates from the states. They've had to turn to parents to make up the shortfall, and they've said that some of these parents haven't been able to afford to make up that difference, and they've actually had to pull their kids out of childcare. Now, right now, 55,000 families receive Child Care and Development Fund vouchers from the state. These vouchers help families with lower incomes pay for child care. And during the pandemic, that number was much higher. There were 68,000 families getting vouchers, a lot more than we see right now. And that's because eligibility expanded during the pandemic because the state had federal COVID-19 dollars to work with. That funding isn't there now, so the state has to make it up somehow, and they cut reimbursement rates to providers. That's how they made it up. Last session, the legislature did provide close to $150 million more for this fiscal year so that families already on the program could keep the same income eligibility. Democrats have criticized the reimbursement rate cuts, pointing to the Republican majority's decision to expand private school vouchers during the last legislative session. Now, Adam Olson, he's the director of the Office of Early Childhood and Out-of-School Learning that administers the CCDF vouchers funding, said in a press release, "We made this decision to protect the children and families that depend on CCDF vouchers. There is only one pot of money. We could either protect providers or kids, and we chose kids."